And now it's time for The Doctor Is In.
Hi, I'm April Douglas with The Doctor Is In, and today our guest is Dr. Matt Barber with Alabama Orthopedic Clinic, and we are talking about joint replacement. Hi, Dr. Barber. Thanks for being here.
Thanks for having us.
All right, joint replacement. How do you know if it's time for surgery?
For most patients, they've tried other things, conservative measures, over-the-counter medications, ice, kind of modifying their activities. And if they're doing that and it's not working anymore, or they continue to have pain that limits their activity, they really want to at least start considering whether they may need something more or need some type of surgical intervention.
So no really relief. Is it too early or too late to do joint replacement surgery?
It can be either. So for most patients, they need to be evaluated. Hopefully you're dealing with a good surgeon who obviously would not operate on you until they've exhausted all of the other possible non-surgical things. Some patients occasionally wait too late. They're very fearful about seeing someone or about considering surgery, and they really let a lot of deformity progress, or they let their health suffer to the point that they're not great surgical candidates. And so we like to see those people early and at least advise them about what their options are.
Now, speaking about surgeons, how do you know if you're with the right surgeon?
That's a subjective thing in some forms, but joint replacement surgery especially, there's a lot of data to support the idea that surgeons that do those kind of procedures in high volumes have better outcomes and lower complication rates. So you can look them up on the internet. You can ask them, hey, what do you do? Do you specialize in this? How many of these do you do? Do you have fellowship training in this particular discipline?
So you welcome all those questions because that's going to help them make the informed decision.
Absolutely. We want questions. Those are our best patients that are involved, that understand that what we're doing, it's not happening to them, it's happening for them. We want them to be educated and know about the process and what we do, and that's how they're going to get the best outcome.
Of course, because that's a big decision. And how does a patient know if they're doing the therapy correctly?
So I am very particular after joint replacement, and I kind of part ways with some surgeons and some therapists, particularly with knee replacements. We have a lot of emphasis on elevation, icing, really keeping the swelling down while we're working to get that range of motion and function.
That sounds like so much more to cover. We're going to cover that on Facebook. We hope you'll join us there as we continue this conversation with Dr. Matt Barber.